It's time for another new Kansas City Spotlight. Here's your host, Lauren Scott.
In the U.S., advanced practice providers deliver care when and where it's needed. However, between COVID-19 and clinicians retiring or leaving the field, the demand for safe and high-quality healthcare is growing. So today I'm joined by Angie Mund and Tracy Paul Young to learn more about this growing problem. Good morning.
Good morning.
How are inconsistent insurance rates compromising patients' access to care?
CRNAs administer 50 million anesthetics per year in the United States. And what we're seeing is certain insurance companies, for example, Cigna, just recently announced that they were decreasing reimbursement rates to CRNAs by 15% coming up soon. And the concern about access to care is we have many hospitals that are struggling to make ends meet, and they rely on anesthesia reimbursement for the services we provide, oftentimes to be able to keep their doors open or to be able to deliver a full suite of services to the communities that they serve. And as CRNAs, we're typically the sole provider in rural hospitals and the majority provider in many inner city hospitals as well too. And those are our most vulnerable patient populations that we need to serve. So without adequate reimbursement, these hospitals potentially could have to be as drastic as closing their doors.
Since laws to end provider discrimination aren't being enforced, how does that impact CRNAs, medical professionals, facilities, and hospitals?
I think Tracy touched on a lot of it related to rural healthcare. I want to point out also that these reimbursement cuts can be a major challenge for our inner city facilities. But what we're doing at the AANA is having meetings with our legislators and encouraging them to continue to pressure the Departments of Labor, Treasury, and Health and Human Services to create rules so that when insurance companies are not following the intent of the law of preventing discrimination based on credential, that there are penalties associated with that.
Okay, so where can we go to learn more information about this?
Well, your viewers can go to accesstocare.aana.com for more information. This is a website we've created. It goes into a lot more detail than we were able to go to today in this brief segment about what's happening in the marketplace and what they can do. And I really appreciate the time today. CRNAs, we've affectionately always called ourselves the best kept secrets in healthcare because quite frankly, when you have anesthesia services, we give you really good drugs and we make you forget about us. But you wake up safely, you wake up comfortable, and you receive a good quality service. And opportunity like this to be able to talk to you and your viewers really helps to get the word out on some of the issues that we're seeing out in the marketplace that could impact basically communities all across this country.
This Kansas City Spotlight has been paid for by American Association of Nurse Anesthesiology.